diabetes. So let's talk about diabetes is kind of like the title of this discussion, all things diabetes and how we can the various types of diabetes, and also what you can do. First of all, there's symptoms and warning signals that you might have diabetes and why you need to go to the doctor, get a checkup, and also how to manage diabetes, how to have a healthy life while living with diabetes, the herbs that you can take, as well as what you can do for exercise, especially for those of us that are over 50. Okay, so some things slow down when we hit a certain age. So I'm glad that we're gonna wait for maybe one or two people to show up, but we're gonna outline. Also, I will be providing links that can get you to the information that I've discussed. So that way you can look it up for yourself and have that information access for yourself. And also foot care, taking care of your feet is very important to take care of your feet. So what I'm going to do, since I always upload this video for later for you to catch the replay, I think I'm going to go on into the topic because I don't want to waste bandwidth time and in your time either. Okay, first and foremost, what is diabetes? Because you always hear that word. Some people call it sugar. Some people call it by other names. But diabetes is a chronic, first of all, what it is. Okay? Diabetes is a chronic disease that happens when your blood sugar, glucose, becomes too high, either because your body doesn't make enough insulin, doesn't make any insulin, or doesn't use insulin effectively. What is insulin? Okay, insulin is a hormone produced by the pancreas that acts as a key to let glucose from the food you eat, move from your bloodstream into your cells for energy. Okay, because in the cells, the glucose is converted to ATP, which is adenosine triphosphate, which is the fuel for the body. Okay. Now, when you don't get enough insulin in your body, you're going to experience certain complications, such as when you're starting getting dizzy, getting tired, lightheaded, grouchy. Because diabetes is not something one should play with or ignore. Okay? Now, when there's not enough insulin or your cells stop responding to your insulin, glucose accumulates in the bloodstream, thus raising. Hello, Dia W. Ishak. I hope I said your name correctly. Welcome. Hello, Samira. Hi. We're talking about diabetes, the various types of diabetes, how to manage diabetes in a healthy way without ending up in the emergency room every other month. Okay? So we're going to go back to talk about how when you have excess glucose accumulating in the bloodstream, over time, this will cause serious health problems, damage to the eyes, the kidneys, the nerves, hence neuralgia, and the heart. Okay, and it's linked to some types of cancer. Now, what are the various types of diabetes? Okay, there are like 4 types of diabetes. Okay, type 1 diabetes. That is, the body's immune system attacks insulin producing cells in the pancreas, leading to little or no insulin production. Then we on to type 2. Type 2 diabetes, the body doesn't use insulin well. Insulin resistant. It's not processing the insulin. I was once pre-diabetic. I was insulin resistant. See, okay, Samara writes, my mom has really bad diabetes type 2. She can't seem to control her sugar intake. Any advice for it, or but where can she still have sugar? Okay, when I was diabetic, I got my sugar from apples, blueberries, strawberries, cherries. You don't want to eat grapes because these days the grapes are made to be very sweet. So you want to stick with apples, blueberries, strawberries, and also have her monitor her sugar more often, and make sure she's with a doctor that really is monitoring her diabetes. Okay, because when it's out of control, that's when you need a specialist, an endocrinologist, as well as your primary care doctor to to work with you. Okay, now we're on to gas, because type 2 diabetes, that's the one your mom is dealing with. Her body is not using the insulin properly. So she has a high insulin resistance, and the pancreas can't keep up with it. So go back to your doctor, ask to speak to a endocrinologist who specializes in diabetic care. Okay, but fruit, if she wants sweets, strawberries, um, cherries, sweet cherries, Bing cherries, strawberries, blueberries, blackberries. She can make smoothies, pears. She can make smoothies out of. Well, I had diabetes from the time I was 19. I had diabetes from the time I was 19 to about 50. That's how long I was pre-diabetic. So we're gonna go back to what we was talking about, and then I'll engage the chat. Gestational diabetes. Now, gestational diabetes that occurs during pregnancy, and usually it resolves after childbirth. Pre-diabetes. Blood sugar levels are higher than normal, but not high enough to be classified as diabetes. Pre-diabetes can progress to diabetes if not managed. Okay, I was a pre-diabetic person, and I did not really know how to manage it. They just said, well, you're pre-diabetic, and they really didn't give me much information. I was 19 when I was diagnosed as pre-diabetic or borderline diabetic. And I still went on ahead and ate junk and ate a lot of things that was not really good for me. So by the time I reached 50, I was having a lot of complications, frequent urination, frequent thirst, constantly hungry, which can indicate diabetes. Okay, I finally was diagnosed with pre-diabetes. That's when I was told. And so how I was able to remedy it was about I'll tell you that later on, but we're gonna get back to here. I don't want to lose track. Okay, to manage diabetes, and that means gestational, pre-diabetes, type 1, type 2. Diabetes management includes healthy eating, regular exercise, losing excess weight, and taking medicines as prescribed. There's no cure, but adopting lifestyle changes and following medical guidance can help manage or prevent complications. And if we follow a good, clean eating routine and taking the meds and exercising, then the insulin medication or metformin or the insulin, the doctor can gradually lower it. Okay, so it can be managed. Now, we're going to discuss type 1 diabetes. We're going to go in depth a little bit on each of the diabetes that I just mentioned. Type 1. The cause of type 1 diabetes, autoimmune. That is your immune system. That is like the soldiers that protect you from getting a cold or getting sick. It protects you from outside pathogens or pathogens internally inside the body. Okay. Okay. And now, the body's immune system attacks insulin producing cells in the pancreas. So it turns on your pancreas. And now all of a sudden you're realizing that you're not producing enough insulin because your immune system has begun attacking those cells that produce the insulin. So it features little or no insulin is produced because those cells are under attack. So you're not getting the insulin that your body needs to regulate glucose levels. Usually diagnosed in children and adults, but can occur at any age. Treatment requires daily insulin. Symptoms appear quickly. Okay. Type 2 diabetes cause body cannot use insulin properly. See, type 1 is when the body attacked the cells within the pancreas that produce insulin. Type 2 is the body cannot use insulin properly. Insulin resistance or doesn't make enough insulin. Okay? Features the most common type, and type 2 diabetes is the most common, such as what your mom is dealing with, Samaria. So about 90% adults are had that are diagnosed. That's what happens is in adulthood, but it is now is increasingly diagnosed in youth. Symptoms can develop slowly. Treatment: lifestyle changes, diet, exercise, adding more fruit and vegetables to your diet, reducing the bread, the sweet, stop using, discontinue using cane sugar or even sugar substitutes. You can use, there's things such as agave and maple syrup. Okay? So, lifestyle changes. Also, exercise. Walking. Walking is one of the most easiest exercises out there to do. Just put on your shoes and go. Oral medications, metformin, and sometimes, such as metformin, sometimes insulin. Prevention and even remission is possible for some. I was able to reverse the pre-diabetes symptoms. I was able to help my body to heal. I didn't cure myself. There's no such thing as curing. There's only things that help the body to heal itself. Because either the body's going to heal itself or it can't, and it needs more on-board treatment, such as man-made medications or some type of other medical intervention. So it's very important to, be up on it and know what's going on within your body. Okay, now with the what I like about some of this stuff now is that some people say, well, you can't get rid of diabetes. Well, you can manage it, and you can manage it so well that your doctor will gradually reduce your metformin or your insulin. It can be put into remission with good dietary regimen, as well as taking the meds or taking proper herbs, getting adequate exercise. You don't have to live with diabetes forever. Okay, gestational, we already talked about that. Um, Hormonal, no, we didn't. Gestational diabetes is when it occurs during pregnancy. Hormonal changes in pregnancy can block insulin use, can block your body from using its naturally produced insulin. And it occurs only during pregnancy. Affects women previously free of diabetes. A woman could never have had diabetes, and all of a sudden she's diagnosed with diabetes during pregnancy. And it's because the hormonal changes within her body are blocking her body's ability to use insulin effectively. And that could be dangerous to the mother, both the mother and the unborn child. So, treatment, dietary changes, regular activity, and sometimes medicine. Now, this gestational diabetes, it affects the women free of diabetes generally, but it can clear up after birth, but can increase the risk of type 2 diabetes later, and that's insulin resistant diabetes. Okay, so we go on to the next one, pre-diabetes. Pre-diabetes is kind of like when you diagnose when you're kind of borderline diabetic. Back in the days, 40, 50 years ago, they call it borderline diabetes. But it's today they call it pre-diabetes. Okay? And what it is, blood glucose levels are higher than normal, higher than usual, especially after they do a blood fast test and they can still see that it's high. Okay? So what they do, they want to monitor you. They will monitor you. They send you home with a glucose monitor, and they want you to monitor your blood to rule out actual diabetes. And But oftentimes with prediabetes, the blood glucose level is higher than normal, but not high enough for diabetes. That's why oftentimes it's good for your doctor to monitor you over a period to rule out actual diabetes. And it doesn't hurt to get one of those free monitors that's covered by your insurance and just monitor your blood. Even if you may not have diabetes, it's good to monitor your blood. Ask your doctor what is a good range for blood sugar, and I could look that up too for you. Good ranges for blood sugar, and you can always ask your doctor blood sugar ranges because we need to know what's going on with our bodies. Always need to know. Okay. Now they talk about other types and rare forms of diabetes. Maturity onset diabetes of the young, caused by a genetic mutation, runs strongly in families, appears before the age of 25. Then you have neonatal diabetes. We're not going to go into these. We're just going to know that they exist. That's diagnosed under the age of 6 months, not caused by autoimmune problems. Wolfram syndrome, genetic disorder causing diabetes. Then they have one latent autoimmune diabetes in adults, sometimes called type 1.5, features both types 1 and 2. Then type 3C diabetes, diabetes caused by pancreatic disease or surgery. Then you have steroid-induced diabetes, steroid-induced diabetes, which comes about from taking steroidal type medications. Cystic fibrosis diabetes, developed in people with cystic fibrosis. Okay, monogenic diabetes, single gene mutation, rare and sometimes misdiagnosed. And type 5 diabetes, malnutrition related, recently recognized, mainly linked to long-term malnutrition and in some parts of the world. Okay. Now, when you want to know what is the difference between diabetes 1, type 1, and type 2. Okay, type 1 diabetes, the cause is autoimmune. The body attacks the pancreas, stops insulin production, or slows it down greatly. Type 2 diabetes, the cause of type 2 diabetes is insulin resistance. The body makes insulin, but it doesn't use it properly. Okay? Type 1 diabetes, age of onset, mostly children. Young adults can occur at any age. Okay, for type 2 diabetes onset, mainly adults over 40. Now is seen increasingly in children and teenagers. Onset speed, type 1, sudden, rapid onset of symptoms. For type 2 diabetes, gradual, slow onset. Symptoms may be hard to spot. That's why it's good to go to your doctor for your annual physical. Insulin production. For type 1 diabetes, little or no insulin is being produced because the body's autoimmune system is attacking the cells within the pancreas that produce insulin. But in type 2 diabetes, insulin is made, but it isn't used effectively. Not enough is made. Treatment for type 1 diabetes requires daily insulin. Healthy lifestyle is very important. Adequate rest, adequate hydration, adding plenty of fruits and vegetables to your diet, less bread, less fried foods, less processed food, and getting away from cane sugar. Okay? And those artificial sweeteners are not good either because that's just straight up toxic chemicals. Not even the ants will mess with aspartame. Okay, so you want to really work at changing your lifestyle. Okay, treatment. Okay, here we go. Insulin is made. Okay, for the treatment of type 1 diabetes, requires daily insulin and a healthy lifestyle. Type 2 is managed also with a healthy lifestyle oral meds such as metformin, and sometimes insulin. Risk factors of type 1 diabetes, family history, some genes, the cause is unclear. Type 2 diabetes, risk factors, age, familial history, ethnicity, overweight, or obesity. Okay, prevention and remission of type 1 diabetes cannot be prevented or cured. Research is ongoing. Okay, type 2 diabetes, often preventable, remission possible when lifestyle changes. Okay, alrighty. So, what we see here is that there are differences between type 1 and type 2, but it's not the end of the world because I think when we take care of our bodies and eat the right foods and take the right herbs, I believe that it can be managed, if not put into remission, because I no longer have pre-diabetes. I'm no longer am pre-diabetic. All right, now that we know the different forms of diabetes, type 1 caused by autoimmune, type 2 the body doesn't manage the insulin properly. Type 3 gestation occurs in pregnant women in some pregnant women during pregnancy, usually goes away after pregnancy, but can in some lead to type 2 diabetes. Okay, and then we have the last one that is the last form is where you pre-diabetes is where you're diagnosed as borderline diabetic because the glucose levels after a blood fasting test has been performed are slightly above normal, but not high enough to be diagnosed as diabetes. So it's like here when it should be here. So over time, perhaps your doctor or endocrinologist will have you monitor your blood sugar throughout the day for maybe 30 days or something so they can get establish a baseline and make sure that there are no underlying causes going on. Okay, now we got that out the way. You may ask, okay, how the hell? Okay, I've just been diagnosed with diabetes or borderline diabetes. What do I do from here? How can I manage it? How is it going to affect my lifestyle? Okay, managing complications for both types, because mainly we're going to talk about type 1 and type 2. Those are the main ones. When I encounter folks, either they have type 1 or they have type 2. Most people usually have type 2. Okay, managing complications for both types requires key strategies. Having a key strategy, a plan. Okay, and so it involves a combination of medical treatment, healthy lifestyle decisions, and regular monitoring. Here's how to reduce and manage complications for both types. Okay? All right. Tight blood sugar control. Keeping blood glucose, which is the alphabet letter A, 1C for Charlie. A1C within target range is the single most important step for both types of diabetes. This helps prevent or delay damage to the heart, kidney, nerves, eyes, and more, and also to your feet, your limbs. Okay, a healthy diet. After you are monitoring your sugar and you're keeping what's going on and keeping it within the target range by paying attention to the levels and then adjusting them with the prescribed medications. Okay, healthy diet. Eat balanced meals focusing on whole grains. If you eat meat, lean and proteins, healthy fats, and plenty of vegetables. Avoid excess sugar and refined carbs, such as baked goods, cookies, also potato chips, junk food, donuts. I used to love to eat donuts. I used to love pastries. I had to give all of that up because it's made from refined sugar. Okay, so now that we're talking about healthy diet, This is where you can add some herbs that can help manage your diabetes. Okay, so there are herbs that you can take that can help keep your sugar levels even. Burdock root. Dr. Savy recommended some herbs for people living with diabetes. Burdock root, which is used for blood purification, liver detoxification, and potentially supporting balanced blood sugar. It does level out the blood sugars. It just helps the body to do what it's supposed to do. So, burdock root helps the body to regulate blood sugar. Dandelion. Now, those little yellow flowers you see popping up in your garden, to many of you, it may be the bane of your existence. That's dandelion. It grows like a wild weed, but that is medicinal. Its flowers, its stems, its leaves, its roots are all medicinal. Okay, and they're great for lowering sugar. Okay, it supports dandelion. It supports kidney and liver health and may have mild sugar lowering properties. That crazy wild weed in your garden. Okay, now we're going to go on to Cascara sagrada. Okay, this herb is known as a gentle laxative and it supports digestive cleansing. When your gut is in order, also your blood sugar starts to fall into order because it all starts from the gut. The pancreas is a part of your gut system, your digestive system. Sarsaparilla, used for blood cleansing and antioxidant properties. Okay. Also, Irish sea moss and bladderwrack. Okay. Used for mineral support and overall vitality. These two herbs you can get from the ocean, sea moss and bladderwrack. It's like a seaweed. They're seaweeds. That's what you get from the ocean. Okay. We went over those herbs that really help. Also, gargum. I don't know about gargum. Now they mention gargum gum, but Dr. Sabi doesn't. Gargum is a fiber supplement. That's something you have to talk to your doctor about. And also garlic supplements. Those two things you might want to talk to your doctor about. You don't want to try any herb without first consulting your doctor. Now we're going to go back to managing diabetes. And that was under what I just discussed is under healthy diet. Okay. And staying hydrated, staying away from alcohol if you can. If you do drink, reduce the drinks. They like say if you usually have two drinks, just have one drink. Okay. So have that one drink and then the rest is water. Or maybe soda water with lemon or something. I don't know what they mix there, but they can come up with something without alcohol or sugar in it. Okay, regular exercise. I don't like to exercise, but I do enjoy walking. So I go walking. Just anywhere from at least 30 minutes to an hour. Start out 15 minutes. If you don't like moving about and or you thinking about exercising, it's good to just start with walking. Put on your comfortable shoes and walk for about 10 to 15 minutes. And do that until you can go maybe to 20 minutes. Then and then more and more time. Because before you know it, you will really enjoy walking. Okay. Now, for some of you that like need more, that want more intense exercise, there is also running, swimming. Swimming is really good, especially for seniors. Those of us who are over 50. If you don't know how to don't know how to swim, I'm quite sure your local YMCA or community organization may teach people how to swim. Okay. Swimming is very good exercise, and here's why. There is no impact. It's a non-impact exercise. The buoyancy of the water supports you, so you're not jumping. Putting your joints under stress with running or aerobics or running in place. So walking and swimming are some of the best exercises out there. But you can always If you have a gym membership, utilize that more often. That really helps. Also, dancing. If you like to dance, dance like as if no one is looking. Put on your favorite music. No one's home. It's just you and the four walls. Dance to your heart's content. And you can do it in spurts. You can dance for 10 minutes here, 10 minutes there, 10 minutes there, and it adds up to 30 minutes. Exercise does add up. You don't have to do it all within one 30-minute swoop. You can break it up into 10 minutes here, 10 minutes there, or 15 minutes here, 15 minutes there. You take your lunch break at the job, and if you work in an office job and it's sedentary, you get up and you walk around. You can walk around the building or something and get a little exercise, even if it's just for 5 minutes. That movement counts up. It adds up, it accumulates. Okay, that just is burning more calories and you're making yourself healthier. Okay, all right. You want to adhere to taking your medications. Okay, it's very important that you take that stuff as directed by your doctor. Take medicines, insulin for type 1, oral medications, and sometimes insulin for type 2 as prescribed. Don't skip any doses, okay? And adjust doses if needed under medical guidance. Insulin and metformin, they're powerful drugs. You got to be really careful with those. Pay attention to what your doctor is saying. Make sure you have a doctor with whom you trust and have a good rapport with, because this diabetes is ongoing. So you need to have someone with whom you can have an ongoing patient doctor relationship without any hiccups in the communication. Because it's very important to let your doctor or their staff know what's going on with you. Routine monitoring. Use self-monitoring devices like blood glucose meters and continuous glucose monitors to track sugar levels and quickly respond to changes. So check your blood level throughout the day. And discuss whatever works best for you, what monitoring method works better for you. Talk to your doctor about that, so that way you are consistent with monitoring those blood glucose levels. Blood pressure and cholesterol control both should be managed with diet, exercise, and medications if needed to reduce the risk of heart disease and stroke. Okay, before I go further, metformin, one of the side effects of metformin is high blood pressure. Okay, and if you already have high blood pressure, talk to your doctor about it before they prescribe that particular drug for you. Okay, um, because it has been linked to it. It has a lot of side effects. And when you go to see your doctor, ask your doctor. Just ask him, hey, him or her, look, I have hypertension. Is it true that metformin raises blood pressure? If not, let's look it up on the internet, because your doctor have this little laptop that they carry everywhere with them, and they can access that information, the effects of metformin and high blood pressure. And I can leave that in the links below. Okay, so I just want you to be aware of that. Second, avoid smoking. Okay, you want to avoid smoking. Metformin and high blood pressure. Just making a note to myself. Okay, smoking, it goes without saying. Smoking raises the risk of diabetes complications, including cardiovascular, kidney, nerve, and eye problems. Okay, when it talks about cardiovascular, you're talking about your heart and your vessels. Okay, it raises cholesterol and it damages your heart. It has so many chemicals that are toxic that you're pulling into your lungs. And the same thing applies to vaping. Some people think, under the assumption that vaping is less harmful to the lungs than smoking actual cigarettes. No, vaping is just as harmful. So if you can, avoid all forms of smoking. If you take in cannabis, maybe consider their edibles or sugar-free edibles, or getting some oil and adding it to olive oil and taking micro doses. There are ways you can get cannabis into your system without resorting to smoking it or vaping. Okay, you want to make sure you do regular checkups with your doctor. Keep all your medical appointments. Doctors can screen for complications early, like neuropathy. Neuropathy. That's the disease of the nerves when your feet start tingling or your fingers are tingling and you can't feel any sensation in those limbs. That could be the beginning onset of some type of nerve damage. So it's very good to see the doctors so they can check you and make sure your nerves are not being damaged. Okay. Also, they can check for retinopathy, checking the eyes because diabetes does affect vision. Also, kidney damage. They could check renal. You see, check for renoplasty. Any renal disorders. Okay, and that's any kidneys disorders. Also, and once they do those checkups, they can intervene quickly. If there's something going on with your kidneys or with your eyes or the nerves, they can intervene quickly. That's why it's good to have a good rapport with a good doctor. And many of them are out there waiting for you to knock on their door. All right. Also, take care of your feet. Cannot stress this enough. Your feet and your hands. Take care of your feet because I had loved ones who passed on. It started when they started losing toes, but it started even before that when they were saying they was feeling tingling in their toes, or they couldn't feel their toes, or there was numbness in parts of their toes. If you experience any numbness, any tingling in your hands, your feet, let your doctor know right away. Don't even wait for the appointment to see them. Schedule an appointment as soon as possible and explain to the person answering the phone, look, I'm experiencing tingling sensations in my feet. It's been ongoing for several days. Sometimes my feet feel numb. Okay? So it's good to know what's going on with your feet. Okay? And especially if you get cuts or sores or infections, report that immediately to your doctor, promptly to your doctor, because diabetes increases the risk of infections and amputations. Because diabetes, especially with type 1, is an autoimmune situation. So it makes it harder for your body to heal. So you want to make sure you make sure you that don't turn into an infection. Okay. Mental health and support, psychological care. Dealing and living with diabetes can be stressful, emotionally stressful, and it can affect your well being, your mind. Because when I was living with diabetes, I was too young and stupid to really realize. But then as I got older, I had to really pay attention to what I'm doing. Hi, Soul Sister Number One Show. Good evening. Hi, nice to see you. And have a good evening if you have to take off and take care of business. Cause I know you're busy. It's just nice to see you. Okay. So mental health care is very important when you're living with diabetes. Okay. Because you're going through a lot. You're going to have to make dietary changes, lifestyle changes. So it's hello, Lucky. Hello, Fletcher C. Hello, Sarso. Hello and welcome. Hello, some dude. Welcome. Okay. Now, in mental health care, you let them know, hey, I'm dealing with diabetes and what support can I get? And also, they have online support groups. Some communities may have local support groups for people who are living with diabetes. So you're not alone in living with this chronic disorder. Okay? It can be managed, it can be sent in remission depending on how you and your doctor approach it. Okay? All right, so it's very important to get your education, learn about diabetes. I'll place some links in the comment section of sources that you can go to and learn more, get more, obtain more in-depth information on diabetes and care for those care for that condition. And peer support. We just mentioned that with support groups, online support groups, and maybe I could put a link down there for online um, support groups for diabetics, online support, because we all can use support at every now and then for something or another, okay? So to let you know that you're not alone. Okay, you don't have to deal with diabetes by yourself. Because also, when if for those who just been recently diagnosed with diabetes, if your family don't understand, maybe schedule a meeting with your doctor and he can explain it to your family, or you can check out some of these links and you can sit down and discuss it with your family members, because it takes a team effort, because sometimes you might need encouragement to hang in there, or need encouragement to not eat that delicious cupcake. Loved ones say, now mama, we you can't eat that cupcake, because you know what it does to your sugar. Maybe we could find some fruit or something. Oh, you like smoothies, we can make you a strawberry smoothie. So it's alternatives to sweets, okay? um, and so lifestyle interventions to prevent complications. Okay, to prevent um, diabetes complications, both scientific studies and medical guidelines highlight several key lifestyle interventions. Okay, weight loss. Losing as little as 5 to 7% of body weight can lower the risk of complications and may reduce the risk of developing type 2 diabetes by up to 58%. Even modest weight loss improves insulin sensitivity and blood sugar control. Regular physical activity. It aimed for at least 150 minutes of moderate intensity exercise per week. That's about 30 minutes per day. So, yeah, about 30 minutes per day. Exercise improves insulin sensitivity, lowers blood sugar, lowers the blood pressure, and lowers cholesterol, and helps prevent weight gain. Both aerobic and resistance, such as strength training, are beneficial. Try to spread workouts over 3 days or more per week. And healthful eating habits. High fiber foods, fresh vegetables, whole grains, not wheat, okay? Beans, legumes, and fruits such as chickpeas, berries. We talked about the fruits. Cucumbers, kale, those are good. Turnips are good. So there are foods that you can eat. I think I placed a link to Dr. Sabi's in one other video to foods you can eat that is recommended by Dr. Sabi. Okay, reduce intake of added sugars, highly processed foods, refined grains such as baked goods, bleach flour, stuff made out of bleached flour is not good, and unhealthy fats. Avoid lard, Crisco, these generic, these vegetable oils. Olive oil is very good for the heart. Olive oil is very good for heart health. Okay. Choose if you eat meat or animal products, heart healthy proteins such as fish, such as salmon, trout, lean poultry. I always mess those words up, get them mixed up. Lean poultry. So if you have chicken, lose the skin. So you can have chicken but get rid of the skin. Okay. And also turkey, that's another lean animal source of protein for those of you who are meat eaters. For those of you who are vegan, chickpeas, walnuts, um, tahini, which is sesame seeds. Even though Dr. Sabi doesn't recommend it, tofu are good sources. Almond butter, they're good sources for protein. Okay, so keep up with your medical checkups and checking throughout the day, blood monitoring. Also, we're going to go on to stress and sleep management. Try to keep your stress levels down by taking time to breathe. Take time to come home to yourself. Because when we're under stress, our mind is over here, our body is over here, and our soul is somewhere else because we're just fragmented. So you want to take time to breathe, which allows your mind, your heart, and soul to your mind, your heart, or your soul, and your body to come back together. You need your mind, your soul, and your body to come back together from being all stressed out. Stress makes us feel scatterbrained. That's because we're fragmented. So when we take deep breaths, it brings it all back home to self, and you can recenter. And when you take a breath, you don't have to take deep breaths. Just take a normal breath and pay attention to the in and out of the breath. And that can greatly reduce the stress levels. Because if you're diabetic, you don't need any more stress on board, okay? So, or anybody. So, reducing your stress reduces cortisol levels. And one day we will talk about stress. Okay, make sure you get adequate sleep. You must get adequate sleep, okay? So, the importance is at least 8 hours or more of good sleep. It's good to be in bed before 10 p.m., at the latest 11 p.m., so that you can get that healing time from 10 p.m. to 2 a.m., that time where your body repairs itself, it does the healing work. And so, if you're living with diabetes, adequate sleep is very important, as well as adequate hydration, drinking plenty of water, staying away from sweetened beverages such as energy drinks, soda pops, any other carbonated beverages that contain sugar. Reduce your either eliminate or reduce your alcohol intake. And if you have concerns about that, there are many support options available for those that might be struggling with that situation. So, um, also turmeric is really good for helping to improve insulin sensitivity, and it helps with inflammation and blood sugar control, as well as sage. Sage is another good herb. And black seed. Black seed oil is very good for lowering blood sugar. So there are ways to manage living with diabetes. You want to make sure that you talk to your doctor before trying any herb or any type of supplement. Okay, you want to make sure you talk to your doctor about that. Um, Never attempt to change what your doctor prescribed without consulting them first, because you're both a team. They're depending on you to communicate what's going on with you, and you have to be able to trust them. If you can't trust them, find another doctor whom you can trust. Okay, because managing diabetes is like walking a tight rope. It's very delicate, but it can be done. And I'll put a link to Dr. Sabi's website, um, because he had a remedy that helped the body to actually eliminate diabetes. There's no cure. What his herbs do, and what any herb do, it just helps the body to remedy diabetes. It helps the body to regulate the glucose levels properly. It helps the body to heal. Herbs don't cure anything. It just provide added support that allows the body to do what it's supposed to do. And so before you think about trying any herb, just talk to your doctor about it, or a naturopath, or a licensed nutritionist who is familiar with Dr. Savi's methodology. Okay? Okay. Well, I think that sums up a lot of things. Now, some people might wonder, well, what if I don't have diabetes, but yet I feel like there's something wrong? Okay. If you're not diabetic, you haven't been diagnosed, if you have not been diagnosed as diabetic and you're experiencing symptoms and warning signs, okay, classic diabetes symptoms: frequent urination, feeling the need to urinate often, especially at night; excessive thirst, feeling very thirsty even after drinking fluids, such as drinking plain water, not sweetened beverages because you feel thirsty after drinking sweetened beverages because of the excess sugar in that beverage. So feeling thirsty after drinking fluids, excuse me, extreme hunger, frequently feeling hungry even after eating, unexplained weight loss, losing weight without trying, more common in type 1 diabetes, fatigue, always feelings of tired, lethargic, even where rest doesn't even help, blurry vision, vision that becomes fuzzy or hard to focus, slow healing cuts and bruises, wounds that take longer than usual to recover, tingling, pain, and numbness in the hands and feet, which is what I mentioned previously in the video. Nerve symptoms are more common in type 2 diabetes, known as neuropathy, such as disease of the nerves. Okay? And this is when you start experiencing these type of symptoms regularly, more than 2 or 3 days in a row, or even more than one day in a row. If it's sudden confusion, trouble speaking, or understanding speech, call 911. Chest pain, shortness of breath, severe dizziness, weakness, numbness, especially one sided, loss of consciousness, or inability to stay awake. That may indicate if you're experiencing the sudden confusion, the chest pains, shortness of breath, dizziness, loss of consciousness, or you can't seem to stay awake, it may indicate serious emergencies like stroke, heart attack, or severe blood sugar imbalance and requires you to call 911. So if you're experiencing that, you call 911 because only when you get to proper medical care, get to the ER, they can figure out what's going on in your body. Okay, so we covered pretty much everything. We covered the types of diabetes, such as type 1, that's caused by an immune system attacking cells that produce insulin. Diabetes type 2 is when your body is not properly utilizing the insulin. Okay, it's not providing enough insulin to keep your glucose levels balanced or even. Okay, and then we talked about gestational is when it occurs during pregnancy, but it usually resolves itself after pregnancy. But those who experience gestational diabetes, it makes them more vulnerable to type 2 diabetes. Okay, and then we talked about pre-diabetes is when you have higher than usual blood sugar and it's constantly higher than normal, but it's not high enough to reach the threshold where it's diagnosed as diabetes. So it's like here, that's pre-diabetes or how it's known back in the day, aka borderline diabetes. Okay, so we discussed the different types, okay, and we discussed um, how you can get the exercise. Walking is really good, swimming is really good. And those of us who are over 50, maybe you might want to look into swimming. Walking and swimming, they're the best exercises for total overall body workout as well as burning off the calories. Okay? All right. So, thank you for coming by. But you know what? Before I go, I think it's good to discuss metformin because I think it's a good idea because a lot of people are prescribed metformin. Okay, okay, metformin. Let's see, because a lot of people are prescribed that, and diabetes, and a lot of times people don't are not familiar with it. Okay. The main drug that is prescribed for diabetic care is metformin, okay? And the side effects are include high blood pressure. Um, so it includes high blood pressure. Let's see, make sure. Here we go. All right. Metformin. Okay, side effects. All right. The main one is high blood pressure. Okay. And digestive systems. Usually some people get diarrhea, bloating, gas, nausea, abdominal pain, constipation, and other disruption of the gastrointestinal tract. Fatigue and headaches. Some folks may feel tired, dizzy, or get headaches. Vitamin B12 deficiency, which occurs with is possible with long-term use. Hypoglycemia, rare with metformin alone, but likely when combined with other diabetes medications. Serious and rare risk. Serious allergic reactions, sudden swelling, rash, difficulty breathing, or confusion. Drug interactions. Some medications may increase risk for lactic acidosis or hypoglycemia. Regular review by healthcare professional is recommended. Okay. Here's another one called lactic acidosis, a very rare but potentially fatal risk. Symptoms include muscle pain, feeling cold, trouble breathing, severe tiredness, stomach pain, dizziness, weak pulse, and slow heartbeat. This requires urgent medical attention. If you experience any weird effects after taking metformin, call your doctor readily. And if you're experiencing shortness of breath, swelling, rash, and you're confused, call 911. But always pay attention when you're prescribed new prescriptions and new drugs, because metformin um, is a very potent drug, and it can cause many side effects. So you want to be careful with it. Um, and I can put a link, side effects of metformin. So if your doctor happens to prescribe it for you, you both can discuss maybe an alternative to metformin. Okay. But diabetes can be controlled with herbs. It can be controlled with exercise and dietary and lifestyle changes. For some, if they follow this lifestyle, healthier lifestyle, to manage the diabetes. For some, the diabetes have gone into remission, but it's something that must be maintained for the rest of one's life. It's something that you can't just start and stop it. Once you make a lifestyle change, you must be willing to commit to it. And you take it in steps. You and your doctor are the best ones to decide um, what to do, what path to take. But this information is provided just for informational and for educational purposes only. I'm not a doctor. Okay. Also, if you like what you just heard, please feel free to subscribe or drop a like. I appreciate it. If you don't, I still appreciate you stopping by. All content here on this channel is free. There are no paywalls. There's no cash app begging. Everything, all content is free. Okay, you don't have to join a special membership group. Everything here on this channel, especially under Harlow Reigns Hangout, is 100% free. No tricks, no gimmicks, because we value your time. And also, no ads. So no disruptive ads to disrupt the flow of the information. And that goes for all the content here on this channel, at Harlow Reigns Hangout. Okay? So you all have a wonderful day. Thank you for stopping by. Namaste. And take time to breathe and be kind to yourself. Thank you.